Hello everyone, this is Isaac White from the Crockett Tavern Museum here in Morristown, Tennessee, and we want to welcome you all to yet another Fun Fact Friday. Now, for those of you who have been following along on Facebook and YouTube, then you know that we have done two anthology series about not only the Battle of Kings Mountain, but also the life and adventures of David Crockett. And slightly in keeping with the anthology theme, well, we're going to be doing that for the month of September, but we will warn you, especially for those of you who have weak stomachs, that you might want to watch these episodes at your own discretion. Because, suffice it to say, things are going to get kind of brutal, kind of gory, because for the month of September, we're going to be talking about medicine and medical practices of the 18th and early 19th century. Now, of course, today, many people take the modern field of medicine for granted. This is due to the fact of the matter that doctors today, they have a vast understanding of diseases, illnesses, and of course how to treat certain injuries or perform very extensive surgeries. And even patients not only have easy access to hospitals, but also access to several kinds of medicine over the counter to help with illnesses or injuries. But it was not always this way, because in the 18th and 19th century, people were far removed from the vestiges of civilization in many cases, and not everyone could get to a hospital or a physician. And we'll talk about that here in just a moment. But of course, another reason that things were, as some people have said about the medicine and medical practices of this time, brutal at best, it is slightly true, mind you. But one of the reasons that people go ahead and think that is because the stuff seems so primitive. It seems so barbaric. But it should be borne in mind that a lot of these procedures and medical ideas were considered revolutionary for the time. They're working with what they had on hand, same as anyone in the backwoods. But what we see ended up happening is that a lot of the medical knowledge of this time was very limited to physicians and apothecaries here in America, because a lot of the knowledge was being trickled down slowly but surely from England to the colonies, gradually the States, and also at this time in American history, we only have two medical colleges. The first was King's College, established in New York in the year of 1767, and also the Philadelphia College of Medicine, established in 1768. But now, if you could afford to go to medical school, you're really not going to be actually learning how to deal with your patient. As a matter of fact, once you had went ahead and set up your practice, the first patient you saw was the first patient you laid your hands on. And this was largely due to the fact there were no clinical studies at the time. Rather, your time in college would be spent learning about philosophy as well as medicine and surgery via the works of Galen and Hippocrates. If you were lucky, you might receive an anatomy lesson once or twice, but that was essentially the bulk sum of your medical training. When the time came for you to pass the bar, so to speak, you would have to go and present and defend your thesis in Latin to a board of doctors, and if you had done that successfully, you would receive your medical license, and that meant you could now practice. However, there was another common practice taking place at this time, which some historians argue was more practical than going to a medical college. And we see in some cases this still goes on to a certain effect to this day, but a lot of people would actually go and pay an experienced physician so that they could observe and practice under their tutelage for a period of 7 years before they obtained a certificate of proficiency. And interestingly enough, this certificate allowed that person who had not gone to medical college the same rights, practicing rights, as your average doctor. Now, we're going to get into a little bit more about this, as well as some of those who had not gone to college or gotten a degree, in the next clip. So stay tuned as we learn more about medicine and medical practices of this time period.